In the current season of The White Lotus, the drug Lorazepam has been introduced as a focal point in the story, revealing some uncomfortable truths about its effects. The portrayal of Lorazepam, while giving the show a dramatic edge, also brings to light the serious risks associated with this powerful medication. It's easy to get caught up in the plot lines and assume that such medications are harmless or merely part of a larger narrative, but the truth about Lorazepam is far more concerning than what's depicted on screen. Lorazepam, a benzodiazepine, is prescribed primarily for the management of anxiety and panic disorders. It works by enhancing the effects of GABA, a neurotransmitter that induces a calming effect on the brain. However, while it can offer temporary relief for those struggling with intense anxiety, the medication comes with significant risks, especially when it is not used exactly as prescribed. Despite its portrayal as a harmless, go-to solution for stress and anxiety in The White Lotus, Lorazepam is not a drug to be taken lightly. One of the most troubling aspects of Lorazepam, and something that the show glosses over, is its potential for addiction. Both psychological and physical dependence can develop quickly. As the body builds tolerance to the drug, users find themselves needing higher doses to achieve the same effect, creating a dangerous cycle of escalating use. This dependency can easily spiral, with the individual relying on the medication not just to manage anxiety, but also to simply feel normal. While the show depicts characters using Lorazepam for social anxiety and temporary stress relief, it fails to fully capture the risks of dependency that so many who use benzodiazepines face. Beyond addiction, Lorazepam's side effects are profound. Its sedative properties make it dangerous to operate machinery or drive, and it can impair motor control and cognitive function. The drug's sedative effects also increase the risk of overdose, particularly if it's combined with other depressants like alcohol or opioids. In one of the more concerning moments in The White Lotus, a character consumes Lorazepam and alcohol together, a combination that is highly dangerous in real life. This can lead to respiratory depression, where breathing slows to a halt, and can even result in death. It's not an exaggeration to say that mixing Lorazepam with alcohol, as shown in the series, is a recipe for disaster. Additionally, the portrayal of Lorazepam's disinhibiting effects in the show is more than just dramatic flair. The drug can impair judgment and decision-making, potentially leading to reckless behavior or exacerbating existing mental health issues. In the case of Timothy's downward spiral, the medication seems to blur his ability to think clearly, which could potentially heighten feelings of hopelessness and desperation. While Lorazepam does not directly cause suicidal thoughts, its disinhibiting effect can make a person more likely to act on those thoughts, especially when combined with other forms of emotional distress. Perhaps most alarmingly, the show neglects to address the potential withdrawal symptoms associated with Lorazepam. For individuals who have developed a tolerance or dependency, abruptly stopping the drug can lead to serious health complications. Withdrawal can cause increased blood pressure, flu-like symptoms, confusion, and, in extreme cases, even death. The risks associated with withdrawing from Lorazepam highlight just how dangerous this drug can be, even for those who never intended to misuse it. It's not simply a matter of running out of pills. The physical consequences of stopping abruptly can be devastating. The portrayal of Lorazepam in The White Lotus offers a distorted and oversimplified view of the drug's role in people's lives. While it may serve as a convenient plot device, it also misrepresents the realities of using such a potent medication. For some, Lorazepam can be an essential part of managing anxiety disorders, but it must be used with caution and under careful medical supervision. The risks of addiction, overdose, and withdrawal are all too real. The show's casual depiction of the drug downplays these risks, potentially leading viewers to underestimate just how dangerous Lorazepam can be when misused or taken outside the prescribed guidelines. In the end, The White Lotus leaves us with more than just a plot twist. It serves as a subtle reminder that what may seem like a simple solution to anxiety or stress can quickly become a life-threatening issue. The fictional world of the show should not cloud the very real dangers that come with using medications like Lorazepam. While it may provide temporary relief, the consequences of misuse can be severe and life-altering.